Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Shahina Ram. Today I will discuss the topic of amniotic fluid and its associated abnormalities. Amniotic fluid appears as an anechoic area on ultrasound surrounding the fetal body. When there is a decrease in amniotic fluid volume, it is called as oligohydramnios. And when there is extreme oligohydramnios, it is called as anhydramnios. The uterus will have a small vertex when you measure from the fundus in this condition. Now, amniotic fluid can be measured by two methods. One is the Chamberlain method, in which we measure single vertical pocket of fluid. This should come to be less than 2 centimeter. The other method is the Phelan method, in which we measure the anterior-posterior diameter of the fluid in 4 quadrants and add them together. This should come as to be less than 8 centimeter. On visual ultrasound, you will see that there is an absence of the amniotic fluid area between the anterior uterine wall and the fetal body parts. There will be crowding of the fetal body parts, and there will be difficulty in outlining the umbilical cord. Common causes of oligohydramnios are as follows. Number 1, premature rupture of membranes. Number 2, chronic fetal death. Number 3, post-term fetus. Number 4, IUGR, intrauterine growth restriction. Number 5, renal anomalies, which are the following. Bilateral absence of the renal kidneys or renal agenesis, which is the Potter syndrome. Number 2, infantile polycystic kidney disease. Number 3, bilateral multicystic dysplastic kidneys. Number 4, uretropelvic junction obstruction due to posterior urethral valves. And number 6, the urethral agenesis. Other causes of this oligohydramnios is the following: chromosomal abnormalities such as triploidy and twin-to-twin transfusion syndrome. Oligohydramnios due to renal factors or renal agenesis is usually observed in the early second trimester and carries a bad prognosis, whereas oligohydramnios detected in the early third trimester is usually due to premature rupture of membranes and carries a better prognosis. Now, if we start by scanning the patient, we have to start by scanning the urinary bladder. Presence of urinary bladder rules out any renal factors as a cause of oligohydramnios. Whereas if there is absence of urinary bladder, it points to some defect in the urinary tract and its kidneys. So in the kidneys, you will have the absence of both kidneys in bilateral renal agenesis. Now, the fetus, when this examined to have an enlarged bladder, it is called begacystis, and this will be present with hydronephrosis. This will point to presence of urethral pelvic obstruction, usually due to posterior uterine urethral valve. Now, oligohydramnios will show that the fetal will have a decreased amount of space around it to move. Therefore, the fetal will develop contractures, and this is limb contracture, and there will also be present club foot. Dolichocephaly or increased anterior posterior diameter of the skull may also be present. Now, amniotic fluid is essential for the development of the fetal lungs. So if there is a decrease in the amount of amniotic fluid, there will be lung immaturity of fetal lung hypoplasia. This has a bad prognosis. Now, there's another type of oligohydramnios, which is called as early oligohydramnios. This is present when there is a decrease in the gestational sac diameter in comparison to the crown rump length. So if we deduct gestational sac diameter from the crown rump length, this will come to be less than or equal to 5 centimeter. This is all that has to be covered in the topic of oligohydramnios. I hope this helps you in understanding this topic and helping you in your practice. Thank you. Allah Hafiz.